Now, this startup that we're about to introduce actually brings in as a junction of between these two areas. So we have Park Sunyoung from New Base who introduced View Level, a virtual medical simulation service. Good afternoon. I am Park Sunyoung, CEO of New Base, creating the future of virtual medical training. We use virtual simulation technology so that we can help people acquire medical knowledge to save lives. Over here, you see this service called View Level, which is what we provide. You can have an experience of digitally diagnosing, treating, and communicating with patients in order to learn about medical knowledge. And we have established virtual hospitals in the service, and there are various medical skills that you can actually practice using Vulabo in the format of a mini game. So from the point of hospitalization until discharge of the patient, you can simulate the entire process. And prospective healthcare professionals, well, it takes 2 weeks for healthcare professionals to complete clinical practice, clinical training, but it only takes 2 hours using Vulabo. It can curtail your learning time and enhance the learning benefit. I would like to tell you a little bit about the background of why we developed the Vulabo service. So here is the question that got us started. The prospective healthcare professionals who don't have a license yet and who are not trained enough, how should they develop themselves? And in order to become real healthcare professionals, you have to have ideally, you want to have first-hand experience with actual patients. But because they are not trained yet, it could be risky from the patient's perspective to actually have clinical practice by these untrained healthcare professionals. Also, there could be some privacy issues of patients in certain departments such as obstetrics. So in the past, healthcare professionals used a dummy for simulation. However, as you can see, it's a dummy, which is obviously very different from actual patients. And there were a lot of limitations in simulating the diagnosis or treatment of patients using dummies. And now we have seen developments in VR simulation technologies, and this is emerging as a great alternative for a clinical practice of healthcare professionals. However, there are limitations in terms of VR simulation, especially from the developer's point of view, because in the digital and virtual environment of a hospital, it may not be as real as an actual patient. So the challenge here was how to make it as realistic as possible, and at the same time, it had to provide as much coverage as possible, because there are so many departments in medicine and there are so many different skills that the healthcare professionals have to acquire. So we needed to maximize the coverage. And achieving realism as well as coverage was quite difficult. It's much more difficult than developing a game, for example, because we have to actually test and verify the different content, and we have to really provide sophisticated designs in order to make sure that the healthcare professionals can learn these exquisite skills. And that was a big challenge for the companies in this field. And so we have seen some low quality and low price. So there were some companies who were undecided between providing a low cost, low coverage solution versus high price, high coverage solutions. In the hospital, as you know, the patients experience pains across all of their body, not just in particular parts of their body. However, due to the limitations in investment and budget, a lot of the companies introduce these simulations that are specialized for different parts of the body. This means that with every chapter, with every part of the body, you have to use different solutions. And we needed to overcome that challenge. We wanted to enhance both realism and coverage at the same time in VR healthcare education simulation. And that's what we did. We, Vulavo, create the most realistic simulation game using SAS. What we do is instead of being reactive to the needs of the hospitals, we proactively develop the content that the hospitals would need. And the hospitals would pay for the services and the technologies that they want to use. And Vulavo achieves both realism and coverage. To do so, we did data virtualization, modularization, and Unity Engine. This shows our example of data virtualization in a patient, in a digital patient. We analyzed more than 1 million sets of data on real-world healthcare, and we mapped it with the actual resources that were used by the healthcare professionals. So the users can actually experience the digital patients by entering the resources that they use in the real world hospital. So we did the mapping of data and resources to create the digital patients. As you can see here, the age, the height, and the weight data have been reflected in the digital patients. So depending on how you treat them, how you diagnose them, their body characteristics would change. And also, the texture changes in patients can be observed using simulation, and all of that was also possible through data virtualization. Furthermore, any changes in their health status can be shown through data. For example, if they have any problem with staying conscious or with a respiratory system, you can all see that due to data virtualization. And some people ask me, why did you make it 3D? Why didn't you use maybe real action image? Well, if we use real action image, it could actually be easier to develop. However, in doctors and nurses training, they often have to observe the sensitive body parts, and we cannot actually use real life actors or actresses to expose their body parts. Also there's a limit to using these skills if you use real life actors and actresses, and therefore we use 3D technology to enhance the effect of the simulation in this education. And this is a medical skill game. The patient is not the only thing you need. You also need to learn how to diagnose and treat and communicate with the patients. So we offer that experience in the format of a mini game, and it's in a modular format. So you can practice these skills for different scenarios as if you're playing a game. So you can, for example, practice administering intravenous injections or injecting other drugs in the patients. And also, once you repeat and iterate the learning, you can quantify the results of your learning based on data so that the users can self-assess their progress. Usually, medical guidelines have a standardized algorithm for education, so we used that standard algorithm to analyze best practice as well as the students' behavior to produce the reports. In January, Vulabo officially came live, and since then, fire and disaster response headquarters as well as hospitals around the country are using this service. For example, Busan Metropolitan City Fire and Disaster HQ is using this for official education, and also a National Medical Center is using Vulabo service. And also, we had a lot of satisfactory comments from our users. They wanted us to continue developing great content because it can really save their cost in education. And also, in terms of VR medical simulation game, we have these two categories of education for actual healthcare professionals and prospective healthcare professionals. And I believe there is a great potential for us to expand to different categories. I think VR simulation for healthcare could be of interest for the police, the military, as well as the healthcare professionals. And actually, a lot of the stakeholders in these sectors are also showing interest. Now, our so-called role model company is Lerdal. It has a 5 trillion Korean won annual sales, and it's one of the first companies to introduce a body simulation solution. And we want to be the Lerdal of the metaverse. So we will use the web-based solutions to make it more engaging and realistic. And Vulabo is expanding both its platform as well as the medical expertise. Vulabo has digital patients, virtual hospital, and medical skills, which we provide through content. And also, we hope to create profits by providing professional training courses. We want us to be a solution that allows people to share knowledge and skills for saving people, and we hope to contribute to this market going forward. Thank you very much. Thank you. We were able to learn about the actual applications of metaverse and database deep learning to promote healthcare knowledge and healthcare skills on the site.